infrared light from the sun is able to penetrate probably up to about 8 centimeters, according to Scott Zimmerman in this article. And it fundamentally interacts with specifically the mitochondria. And what does it do to the mitochondria? So let's back up and talk about the mitochondria, because this is central.
Dr. Seheult explains that sunlight is far more than just a source of vitamin D. Infrared light, a long wavelength component of sunlight, can penetrate deeply into the body, up to about 8 centimeters, and directly stimulate mitochondria, the powerhouse of the cell. This stimulation upregulates melatonin production within mitochondria, which acts as a powerful antioxidant to reduce oxidative stress. Oxidative stress is a key factor in many chronic diseases such as dementia, cardiovascular disease, and diabetes. The mitochondria's efficiency declines with age, leading to reduced energy production and increased disease risk. Infrared light helps cool the mitochondria, improving their function and potentially extending health span. This insight shifts the focus from vitamin D supplementation alone to the broader benefits of full-spectrum sunlight exposure, and emphasizing the importance of natural light for cellular health and longevity.
So he has one request. He wants to go outside. And that's exactly what they do. And this was actually mind-blowing to me. After the second day, the infection is probably 60–70% gone. And it became clear to me that sunlight has so many important benefits.
Dr. Seheult recounts a remarkable clinical story where a critically ill 15-year-old boy with blood cancer and a severe lung infection was given his dying wish to go outside. Despite no changes in medical treatment, after just 2 days of sunlight exposure, his infection dramatically improved, with a 60–70% reduction visible on CT scans. This case powerfully illustrates the therapeutic potential of natural sunlight beyond conventional medicine. It highlights how sunlight exposure can enhance immune function and recovery, possibly through mechanisms involving mitochondrial stimulation and melatonin upregulation. The story challenges modern hospital practices that often keep patients indoors and underscores the need to integrate natural elements like sunlight into patient care to improve outcomes and speed recovery.
If you can imagine your life is a chain with a bunch of links, okay? And I'm talking medically. Each one of those links is an organ system. So your heart is a link, your lungs are a link, your liver is a link, your kidneys, etc., etc. As you go through life, imagine those links starting to erode.
Dr. Seheult introduces the New START framework, a holistic approach to health encompassing 8 pillars: nutrition, exercise, water, sunlight, temperance, air, rest, and trust. He likens the body to a chain of organ systems where each link represents an organ. Disease occurs when one link weakens or erodes. Modern medicine often focuses on treating the weakest link with medications, which can have side effects impacting other links. Instead, New START emphasizes strengthening all links through lifestyle interventions to promote longevity and well-being. This approach integrates physical, environmental, and psychosocial factors, recognizing that health is multifaceted. The framework encourages proactive habits like balanced nutrition, regular exercise, hydration, sunlight exposure, toxin avoidance, fresh air, adequate rest, and spiritual trust to maintain robust health and prevent chronic disease.
Interferon production goes up with temperature. And in fact, the body's fever mechanism is one of the ways that it tells the body that it needs to increase interferon to deal with the viral infection.
Is that why you feel hot?
You feel hot.
Dr. Seheult highlights the critical role of fever and body temperature in immune defense, particularly through the production of interferon, a key molecule in the innate immune system that combats viral infections. Fever is not merely a symptom, but a purposeful physiological response that enhances interferon levels, making the body less hospitable to viruses like SARS-CoV-2. Artificially inducing mild hyperthermia through practices like sauna use can boost interferon production and improve immune function. Cold exposure following heat therapy causes vasoconstriction, helping retain core body temperature and mobilize white blood cells into circulation, further enhancing immunity. This understanding challenges the common practice of aggressively treating fevers and supports the therapeutic use of hydrotherapy and temperature modulation to strengthen innate immunity.
There's been actually a number of studies looking at plants and trees and the fact that they can give off things like phytoncides.
What's that?
These are aromatic compounds that the tree actually gives off. And when we look to see the effect of these compounds on the human body, they're actually very beneficial.
Dr. Seheult discusses the benefits of fresh air and natural environments on immune health. Trees and plants emit phytoncides, aromatic compounds that have been shown to boost natural killer cell activity and enhance immune function. Studies from Japan demonstrate that spending time in forests rich with these compounds increases immune cell numbers and their disease-fighting enzymes, effects that can last up to a week after a single exposure. This suggests that even occasional time spent in green spaces can have meaningful health benefits. Additionally, good ventilation and low indoor carbon dioxide levels are important for cognitive function and overall well-being. These findings advocate for regular outdoor exposure in natural settings as a simple, effective way to support immune resilience and mental health.
The title was Dark Days and Bright Nights, and that correlated with increased mortality.
I mean, that's how most of us live.
That's the problem. We have dark days and we have bright nights. And what we really should be having is bright days and dark nights.
Dr. Seheult emphasizes the importance of aligning light exposure with natural circadian rhythms for optimal health. Modern lifestyles often involve insufficient daylight exposure, dark days, combined with excessive artificial light at night, bright nights, disrupting melatonin production and circadian regulation. This misalignment is linked to increased mortality and various health issues. To restore balance, individuals should seek natural bright light during the day, ideally outdoors, and minimize exposure to blue light and screens after sunset. Using blue light blocking glasses, dimming lights, and avoiding electronic devices before bedtime can help preserve melatonin secretion and improve sleep quality. Proper circadian alignment supports mental health, immune function, and overall longevity.
Sunlight has far more benefits than just vitamin D. Not saying that vitamin D is not something that you want to supplement with. I supplement with vitamin D. I think there's a benefit to supplementing with vitamin D, no question.
While vitamin D is a well-known benefit of sunlight, Dr. Seheult clarifies that sunlight's health effects extend far beyond vitamin D synthesis. Vitamin D supplementation is beneficial, especially in populations with limited sun exposure or at high latitudes, but it does not replicate the full spectrum of sunlight's effects, such as mitochondrial stimulation by infrared light. Vitamin D acts as a hormone influencing calcium metabolism and immune function, with deficiencies linked to increased risk of autoimmune diseases and infections. Supplementation should be personalized with blood level monitoring to avoid toxicity. Importantly, vitamin D levels often serve as a marker for sun exposure rather than the sole mediator of sunlight's health benefits.
Studies have shown that people who have a good faith and trust in a God that is, or in a religion that is supportive and not non-supportive, they have less anxiety, less depression, have a faith community that they can engage with and be supportive.
Dr. Seheult highlights the significant role of spiritual trust and faith in mental health and well-being. Research indicates that individuals with a supportive religious faith experience lower levels of anxiety and depression, partly due to the social support and coping mechanisms provided by faith communities. Unconditional forgiveness, often rooted in belief in divine forgiveness, correlates with reduced psychological distress. Integrating faith into therapeutic approaches can enhance outcomes for those who identify with a religion. However, the quality of the faith relationship matters. A punitive or fear-based belief system may have negative effects. Respect for individual beliefs and consent is essential when addressing spirituality in healthcare.
Melatonin is a very powerful antioxidant that's very beneficial. The second thing that it's doing is it's confusing your circadian rhythm. You see, your circadian rhythm is designed to see light as day.
Melatonin, commonly known as a sleep aid, plays a crucial role as a mitochondrial antioxidant protecting cells from oxidative stress. Dr. Seheult distinguishes between melatonin produced in the brain to regulate sleep and melatonin synthesized within mitochondria to maintain cellular health. While low-dose melatonin supplements can help with sleep onset and circadian rhythm adjustments, excessive use may cause irritability and potentially disrupt natural melatonin production. Light exposure, especially blue light at night, suppresses melatonin secretion, underscoring the importance of managing light environments for sleep and overall health. Melatonin's antioxidant properties contribute to its protective effects against chronic diseases.